Welcome, everyone. I think we'll go ahead and get started. On behalf of NHF, welcome to the basics track. And can you handle the tooth? Oral health basics. Please go to the next slide, please. We have our speaker, Dr. Allison Dougal. My name is Natalia Winberry, Manager of Education at the National Hemophilia Foundation. Next slide, please. And now a couple tips from getting the most out of this session. Please use the chat box or the Q&A button feature to write in questions or comments. The speaker will try to respond to as many as possible during the Q&A portion at the end of the session. Please be sure to give feedback at the end by filling out the evaluation. This presentation will be recorded and will be available to watch online. Next, thank you. We also have the following disclosures for our speaker. Okay, now if we can turn to our wonderful session, Can You Handle the Tooth? Oral Health Basics. We are very excited to have Dr. Allison with us here today. Dr. Allison Dougal is a consultant and associate professor in special care dentistry at Dublin Dental University Hospital at Trinity College Dublin, and consultant for medically compromised patients at the National Coagulation Centre, St. James Hospital in Dublin, Ireland. Welcome, Dr. Allison, and we will be getting started in just a moment.
So, as already said, I think that knowledge is really powerful. So I think I'm going to start this talk by actually making sure that people have got knowledge on the important things about oral health and dental care, and then understand how perhaps it's a little bit different for people with bleeding disorders. I think key to this is going to be, just like joints or other areas of haemophilia care, how we can use self-management strategies to prevent, to avoid dental health problems. The best dentistry is always no dentistry. And I think, I hope that the question and answers session will help us together develop some self-advocacy skills. And I think nobody would disagree with me that most people want to run in and out of the dentist as fast as they possibly can. So I hope that this is a non-threatening situation for us to be able to, answer any questions. There's no question which is, too basic or too complex. So the importance of oral health. The thing is, oral health is not just about the absence of disease, but it's a wholeness that involves physical, mental, and spiritual well-being. And recently, the definition of oral health was changed to recognize that it includes the ability to speak, to smile, to smell, to taste, to touch, to chew, to swallow, to kiss, to convey emotions through facial expressions with confidence, without pain, and without the presence of disease. And I think that's really important because it's such a holistic view and represents just how important the mouth is. We know this during the pandemic. With the masks that cover the mouth, you lose that whole sense of person. The trouble is that we have a worldwide problem in that more than 3.5 billion people suffer from oral diseases. And in the US, untreated tooth decay, dental decay, sometimes called dental caries, in permanent adult teeth is the most common problem. But with severe also gum disease affecting almost 20% of the global population. And gum disease is the most likely reason that teeth get loose or diseased and need to be extracted. Sadly, still, although childhood diseases are mostly on the decrease, all over the world, more than 530 million children suffer from dental caries of primary teeth, baby teeth, and there is an epidemic of early childhood caries. That's caries, decay in the teeth when you're less than 2 years old. What we know is that these diseases disproportionately affect people who are socially disadvantaged. This is about health messages, but it's also about being able to afford to actually have dental care. So there are huge oral health inequalities. And at source, this is because the mouth, somewhere along the line in healthcare, was separated from the rest of the body. It's kind of included a little bit in medical training, tiny bit in nursing training, but it's sort of somebody else's job. And this is despite its proved negative effects on general health. So what's your risk? These two mouths that I've taken pictures on the right are mouths from people with severe haemophilia. The one on the top belongs to somebody who's 45 years of age. The one on the bottom belongs to somebody with severe haemophilia who's 4 years of age. The thing is that your bleeding disorder does not have any risks for extra dental problems, unlike diabetes or cerebral palsy or cystic fibrosis that may cause defects in the teeth. Bleeding disorders themselves don't cause any problem. However, if the teeth go wrong, within haemophilia, that disease carries a really higher burden. If people need teeth out, there's a higher risk of morbidity, mortality. And we know that bleeding from poorly managed dental extractions is still a worldwide problem, including in the US. We know that gingivitis, the early gum disease, haemophilia doesn't cause the gingivitis, doesn't cause the bleeding, but if you've got gum disease or early gingivitis, your teeth are going to, or your gums are going to bleed for much longer than somebody else. We also know that people with haemophilia have reduced pain medication options. So if they've got toothache and they're trying to access care, they may not have the options of pain medication to be able to deal with that. So that's a massive impact on health, on quality of life, because as anyone who's ever suffered from toothache, it takes over everything else. But it's not just about that. I did, as part of my PhD, a big set of interviews of people with a variety of bleeding disorders to see what actually poor oral health meant to them. And what it meant was, because sometimes they were fearful of getting care or they couldn't access care, they covered their mouths in public, wouldn't smile. That sometimes children who perhaps hadn't had the orthodontics that they wanted were ridiculed or bullied for having sticking out rabbit teeth or crooked smiles. So important now. The media has put real pressure on people to have these white smiles. They worry about spontaneous bleeding from loose teeth, especially in public, where perhaps at a social event they would limit their food choices so that they weren't going to show blood on food. Causes real problems with relationships if people develop gum disease and halitosis, and with intimacy with their partners. Sometimes live with the taste of blood in their mouth or wake up with blood on the pillow. So much different problems when it goes wrong. So I think I want to kind of summarize why we're talking to you today, is that living with haemophilia itself is tough enough. And we cannot control and change sometimes, or even afford many things, gene therapy or whatever, but an unhealthy mouth is an unnecessary burden, because oral disease is 100% preventable. We know the risk factors and we know how to treat and prevent them. And we've got grade A, the highest level A evidence in dentistry. It's actually quite easy, but sadly in most medical care pathways, people forget about the mouth. They don't take it seriously until something goes wrong. It's too late and people are running around trying to get emergency dentistry. So I think it's really time for a rethink in all education programs, that oral health is included in every program, whether it's about aging, whether it's about motherhood, whether it's about adolescence. I think that we need to join the body back to the rest, join the mouth to the rest of the body. We do have the white elephant in the room, and that's about fear and anxiety. I did a talk in the Middle East a couple of years ago, and there was a whole load of families, and they were terrified of letting their children go to the dentist. Now, unbelievably, they were really happy for the children to play on the supersized bouncy castle. And yet you can see there's a mismatch between why people are scared. There's this underlying fear anyway of the dentist. But then often families with haemophilia history are worried because perhaps a grandfather or an uncle some time ago had bleeding after going to the dentist. Or quite a lot of the time, people with mild haemophilia or bleeding disorders, or women with bleeding disorders, were diagnosed following a visit to the dentist. So they associate their diagnosis with the dentist. So all this adds to fear and avoidance of necessary dental treatment. Then there's the dentists who perhaps get very little training about haemophilia and think the minute they touch somebody, there's going to be an eruption of blood. And it's going to be like a kind of horror film, which totally isn't true. And we teach our dentists now. I have all dentists who are training in Ireland coming through my clinic to give them experience, to teach them things bleed for longer, but not quicker or faster, so that we can teach them to manage. There are excellent guidelines for dentists to provide safe care along with doctors. But the thing is, doctors often don't understand the various risks of each dental procedure. So again, are scared or sometimes advise their patients to avoid dentistry or not have certain parts of it, or certainly not to take it as seriously. So I think we have to really address this. And how I've done this, and this is a resource that I'm very happy to share with you, by having a very clear traffic light system of risk that I think is very important for all families and people with bleeding disorders to understand. You can see the green is there, go ahead, don't think about it. This is safe stuff to have done if you've got a bleeding disorder. The yellow is the things that perhaps carry a little tiny bit more risk that may perhaps be done on a prophylaxis day, or may just need a careful handling, but doesn't, still hasn't got any huge risk. And then the red things, which whatever bleeding disorder you've had, mild or severe, needs careful working up, teamwork between you, your dentist, and your doctor. So, for example, you can see the examinations, the x-rays, all of the monitoring can be done without thinking about it. And quite often patients or people will say, oh, my dentist won't touch me, when really they could be doing all of the monitoring close to home. And you can see things like the basic injections in the mouth can be done very, very easily without worry. You think about the cannulas that are used to put in factor or that are used for blood tests, which are 6 times the size of the needles that we use in dentistry. If you look very, very tiny, thin, they're scary, I believe. I know that people don't like these, but the needles are very small. So again, this is something which is very important to realize, that the small superficial injections are not a risk. And in my survey that I told you about earlier, people are confused about this. So again, this can cause barriers if people are scared to have injections before they have fillings and think they have to be super brave. This isn't the case. And we've got literature to produce this. You can see a big systematic review to inform the guidance. And this is now reflected in the World Federation guidance about the safety of injections. You can see that something like orthodontic treatment, braces that we were talking about in the middle. Yes, we've got to be a little bit careful with somebody with a bleeding disorder, because we need to make sure the gums stay healthy. We need to make sure that the wires are not sharp. We need to make sure that people have little bits of wax to put over any sharp bits so they don't lacerate. But there's no danger in moving teeth around for people with haemophilia. And this is another big question people wonder: can my child, or can I as an adult, have my teeth straightened? And we love people have their teeth straightened because it means that it doesn't collect food and doesn't decay the teeth or cause extra gum problems. And then there's the big red stuff that, again, we have all of the protocols to say this can be safely carried out. We now have lots of evidence for people having dental implants, for people having tooth extractions, wisdom teeth out, if they're having problems with them. But this needs careful coordination. And what I do with my patients, and I think it's something you can ask your doctors to provide you with, is a dental passport, which is a letter for your dentist which says, this person has a bleeding disorder, something like the traffic lights. It's safe to do the green and the orange, but should you need to take out a red procedure, there's one very deep injection, for example, on there, then you need to stop, contact me, and not go any further. This is very easy for everybody to understand, because all of the evidence out there shows us that what is going to prevent dental problems is everybody having their own dental home. This doesn't mean going to hospital just when you've got problems. It means somebody has a primary dental home where they've got a dentist who gets to know them, probably the same as the rest of their family. It means that they can provide all the advice, coordinate things, provide the straightforward care, and anticipatory guidance, comprehensive preventive care, and then prevent all those problems happening. There is so much evidence, there is so much evidence out there. The dentists have it on how to prevent care by recalling people at specific intervals. If you've got a high risk for disease, you're a smoker, you've got diabetes, perhaps not particularly good diet or oral hygiene, you'd need to go every 3 months. If your mouth was great and everything was under control, 12 months is perfect. But regular x-rays, preventive sealants as the teeth come through, early intervention for disease, so that the minute there is a small hole or a problem, we can do it with minimally invasive dentistry, biological stuff. We've got great technology now, even in very young children. You can see at the bottom here, on the bottom left, there's a little brown hole developing in a very young child who was not cooperative enough to have dentistry. We've now got biological medicines that are licensed in the US to be able to paint straight away on that decay and stop it in its tracks until the child is old enough to have some more treatment done, so that the disease doesn't progress. Also works incredibly well. It's called the silver bullet. It's silver diamine fluoride. So it's something that means that you don't have to think, oh my goodness, what's going to happen? And lots of evidence out there to show it's effective in younger adults, older adults who can't afford to have treatment or need to save it up. It'll stop that disease getting worse. Because what we're really looking for is stopping children having to have general anesthesia, stopping to have people have extensive amounts of treatment, because this is shockingly fearful for people. And we know that most of our dental phobics in older age is because they had big experiences that were just too much for them to cope with as younger children. So we need to establish good habits in young children, but then keep it going. We also don't need to be scaring children, because fear is a big issue here. So we don't need to be, giving children or adults too much for them to cope with. So how are we going to manage this? What self-management strategies can we do to avoid this? Well, the first big change that was made internationally was that children should start going to the dentist, especially if they've got a medical condition, before their first birthday. And this, people used to think, is it when they have their adult teeth? Is it when they start school? It's before their first birthday, because often children have started to teeth earlier. And by the age of 1, you can see if there's any early childhood caries from milk bottle, from bottles, from a diet, or from a developmental problem, so that parents can actually have the right information before it's too late. This is the big thing to stop us getting 2-year-olds with a mouth full of disaster, really. So before the first year, often children would sit on their parents' lap. They would get to know an environment, and let the dentist have a quick peep, just to check that there's nothing obvious. So that's the first thing. If you have a child with haemophilia, don't wait till the first birthday is the last time. The other big thing is don't let it go in older age, because we've got the first generation of people growing older with teeth. In the past, most people lost their teeth by the time, sometimes in Ireland, in their 40s, or or even earlier. But now we've got people living into their 60s and 70s with a full set of teeth. The thing that happens, though, is often the medications that are taken for things like blood pressure, diabetes, depression, all cause a very, very dry mouth. So the saliva stops protecting the teeth so well. So all of a sudden, the teeth can start going wrong, even if you've had not problems your whole life. So this is why people say, oh, I'm getting older, my teeth are going. It's because of the environment. And we can do something about that. It's the pills that dry up the mouth. But we can actually do quite a lot to prevent that with high fluoride toothpastes, with the use of chewing gum to increase the saliva, but with regular checkups. So when we say what's the key members in your management team for your oral health, you are the most important, because all we can do as dental care providers is give you information and repair damage. So what you do at home is going to govern whether you've got teeth for life. So the first thing is that just like hemophilia prophylaxis, we need dental prophylaxis. This means we have to brush the whole mouth. See toothpaste as a medicine, actually, because it actually not only is helping to remove the plaque debris, but it's actually depositing fluoride onto the teeth. It needs to be done before bed and one other time during the day. There's no rule when it needs to be done. Before bed is because this is when the saliva dries up and does the damage. So the toothpaste needs to be there protecting the teeth. The key different health message to what you may have been taught is once you've put a small amount of toothpaste on your teeth, spit out the excess, but whatever you do, don't rinse it off, especially don't use mouthwash, because toothpaste is there to soak into the teeth just like sunscreen, and it is 3 times as effective at preventing decay if you leave it on the teeth. So if you like using a mouthwash, use it during the day at work, or use it before you're going out or something like that. But toothpaste is there to stay on the teeth, and then the fluoride will protect your teeth. This is the same whether you've got hemophilia or not. So this is a good health message to give to everybody, your friends, your parents. For those people who've got dry mouths or have got a lot of cavities because of their diet or their microbiome, then there is a much higher concentration toothpaste which should be used in place of regular toothpaste. So this is again something that your dentist will recommend or your doctor can prescribe, and this is incredibly effective. So if you're getting cavities, it's not only about changing your diet or your toothbrushing, it's about having a better, stronger medicine, just like you would have stronger painkillers or stronger anything. People ask me about brushes. Should I have a soft brush if I've got a bleeding disorder? And the answer is no. The reason that we have a toothbrush is to physically remove the plaque debris off our teeth. So a soft or a medium brush, but should be a small toothbrush that is used to remove the plaque. But don't forget to brush your tongue as well as your teeth. I know that people worry about brushing their teeth with a bleeding disorder, especially if their gums are bleeding. So all of my patients, I get to educate themselves by using disclosing tablets. You can buy these in the pharmacy. And they were traditionally used to show children how to brush their teeth. But I think if you've got a bleeding disorder, if you chew the plaque disclosing tablets, it binds to all of the bacteria and the plaque on your teeth. You can see it on the picture on the left. It means that you can then, with your toothbrush, remove all of that dark pink plaque. You can go carefully around the gums because it's that plaque which is making your gums bleed. So you can see the picture on the right, the bleeding that's happening after this because of that plaque that's around there. So after as little as 4 weeks of really careful brushing, bleeding gums can completely disappear. And you can see, same mouth, this time the lady, because she's now got her gums healthy, can go and have her teeth whitened, real big pick you up. So you do not have to, live with bleeding gums. And people often ask me, what's normal bleeding after brushing teeth? Well, normal bleeding is no bleeding, because healthy gums don't bleed. It's the biggest misconception in the bleeding disorders community, and we've got huge amounts of research to show that's the case. A couple of spots if you've haven't brushed your teeth for very well for a couple of days, or you're not flossing, is normal. This sort of blood means that you've got gingivitis. There's something going wrong. You need to put some work in. This is not normal for haemophilia. This sort of bleeding, which is not unusual. If I ask patients, new patients, how long are your teeth bleeding? Their doctors never asked them. And the nurses have forgotten to ask them, and they'll say, oh, maybe my mouth bleeds for 25 minutes after brushing my teeth, but not every day. Really stoic. So I think we need to really pick that up. Teeth shouldn't be bleeding. That means that the disease has got past gingivitis and has started to affect much deeper tissues. Can still be treated at this stage, but it needs your attention from the dentist. Not only does it need problems so that your quality of life is better, we know that once you've got that much bleeding, then the bacteria in the mouth can affect heart, kidneys, lungs, diabetic control. So really lots of reasons to look after it. The mouth, the gums, if we spread them out, would be about the size of your hand. And you wouldn't ignore bleeding from your hand every day. And yet somehow the mouth has we accept it, we've normalized it. And yet the inflammation and the blood loss from that can really cause anemia and all of those things. So I think the key member of your haemophilia team, oral health team, after you, is your hygienist. She can help you with cleaning in between the teeth. She can monitor you. She can let you know how you're going. And if you've got gum disease, she can help treat it. And what I would like to say is, if people need to have special gum treatment, really, or even really surgery on their gums, this is where you do need to have consultations with your doctor and your dentist together to make sure. But it's a short amount of time. If you get the gum treatment you need, you perhaps need a course of treatment to get your gums healthy, and then it'll just be a matter of having them scaled and you looking after them again. Diet and nutrition. People ask me, is there anything they can take to make their mouth healthier? It's the same as your gut. The mouth is the same as your gut. So it's an anti-inflammatory diet full of vitamins, lots of green, lots of different types of vegetables. Sugar is an important thing because, we love sugar. We're addicted to sugar. So I think the lesson here that we've learned is that it's not actually how much sugar you have per day that governs whether you get tooth decay. That governs how much weight you put on or how much diabetes risk you're at, but not your teeth. With the teeth, it's about how often you're taking sugar. So, for example, if your sugar is put into your mouth, it starts to be fermented by the bacteria in the plaque. And over the next 4 hours, the saliva works to neutralize the acids that are formed. So if you put more sugar in during those 4 hours, your teeth are weakened and they can't actually protect themselves. So what I always say is, it's always better, I won't tell you what's in this can, but I think you probably know, it's better to have 1 can at meal times than to have a bottle and sip it several times during the morning, because it's that constant sugar attack that will get you more cavities. So think about how often you have your sugar and try and have it at a time when your saliva is flowing, so that your saliva is protecting. And if you can't get your saliva flowing, if it's outside of a mealtime, then perhaps think about chewing gum afterwards. Don't brush your teeth afterwards, doesn't help, but chewing gum, which gets your saliva flowing, will do the work. So finally, the key members of your haemophilia oral health team are going to be your dentist and doctor working together. Your dentist there taking the x-rays, giving you the treatment options. And you don't have to limit your treatment options. We have the protocols now to mean that if you need something, you don't have to accept second best or a substandard dentistry. You should be able to work with your dentist and doctor to get what you need. This is a gory picture, I know, but I just want to show you, for example, the thing that people with haemophilia dread, having to have a tooth out. If you look at the picture on the left, there's a little root left in there from where somebody had a crown, fell out. Nowadays, when we take teeth out, we lift them out very gently using different instruments to what so you can see the hole there is exactly the size of what that root used to be. And then nowadays we put in, with people with bleeding disorders, a membrane which automatically lets a clot to happen and then put a little stitch in afterwards to keep that in place. So together with the systemic measures that come from the hematologist, the two things working together mean that people don't need to worry about having things like tooth out. It means that if you need orthodontics and braces, you don't need to be scared that you can't have teeth out. It means that if you've got your wisdom teeth coming through all wonky and you need them out, you don't need to be scared of having them out. We have the technology and the medicines now to help. And I did a big literature review here to say that you need factor just before you have the treatment done, perhaps 4 hours maximum before. And then afterwards, what the dentist does and you being careful afterwards is enough to stop bleeding in somebody with haemophilia. So much less need, in fact, never do we hospitalize people nowadays having teeth out, for example. So that's the past. We use cyclocapran, I don't know what you call it in the US, but tranexamic acid tablets afterwards, which really help strengthen the clot. So finally, advocacy. Now you've got your information. I think knowledge is everything. So I think from my perspective, I think it's really, really good to make sure that if you're working with your local societies, you have dental education in the program so you can keep up to date and keep reminding yourself. I think you need to work in partnership so that you're working and coordinating your team. You're the person who can bring everybody together, but you mustn't wait for an emergency because you won't know everybody. You won't know the dentist. They need time to get to know you. So you need to introduce yourself and your family and let them learn, and they'll delight in getting to know that you have haemophilia. So long as they know they've got the support of your haemophilia team and you're involved, then I think you can really help become a dental champion for your community. Organise fun or informative activities at the children's camps. Campaign, importantly, in the US for universal dental health schemes, so that this is not something which is not available for people without social means. Create lists of bleeding disorder friendly dentists. If you've got somebody who you know who's comfortable with haemophilia, tell everybody, because you can create a list. Importantly, if you've got friends or colleagues who are phobic or anxious, accompany them, offer to go with them to the dentist to get over that fear, because the fear of the dentist plus the fear of the haemophilia together is sometimes too much for people. And for those people watching, collect data, measure oral health related quality of life amongst people with haemophilia so that we can raise awareness of how important this is. And learn to love your mouth, because it's there for many reasons. So I think I'd like to say thank you, and I'm ready for.
Hello, everyone. Thank you so much, Dr. Allison, for that incredibly informative presentation. We're happy that you're here to join us for our Q&A session. I did want to highlight before we got started our wonderful chat manager has put in several links into the chat space, all kinds of really great resources for you to access within this topic of dental health and oral health care. But I think we should get started with our questions. Again, if you haven't had a chance to put any questions into the chat space or into the Q&A, please do so, and we will try to get those answered. Okay, Dr. Allison, our first question. At what point do I connect my child's dentist and the HTC? When there's braces, maybe potentially surgery, earlier? When should that be happening?
I think that it's as soon as you have a dentist, then your team should know who that dentist is. So I think right at the beginning, give the hematologist that information, and the hematologist can then perhaps, as I said about the dental passport, make contact so that it doesn't happen in an emergency situation. So kind of pre-plan. So let them know that you're in contact with the dentist, let the dentist know who the hematologist is, and then at those key moments, if you need something invasive doing, you need dental extractions, you start to have some issues, then the two are already in contact. They probably don't need to work together, but they need to know that they exist and they need to be familiar. So straight away is my answer.
Great, great. Thank you for that. We have another question that has come through our Q&A box. With wisdom teeth extraction and bleeding
Yeah.
disorders, is it better to let them come in a little before extracting or to
Yeah.
cut them out before they even emerge?
Okay, so there are very, very straightforward guidelines for when to have wisdom teeth out. And for people with haemophilia, it's no different. So wisdom teeth for some people are no problem. They come through into the mouth at about the age of between 18 and 21, if there's space. So, and then they come through like any other tooth. They may be a bit sore as they're coming through. Then they erupt into the mouth, and people have to just remember to clean back far enough. Some wisdom teeth don't come through at all because there is no room and they stay buried. And at that point, you don't need to do anything with wisdom teeth because the guidelines now say that they don't need to be removed just because they're there. So if they're there and they don't come through, then we now leave them be. We leave them alone. However, some wisdom teeth start to come through and then they get stuck because there isn't room. So food gets trapped around them. We can clean them thoroughly, but we generally say that a wisdom tooth would need to have been pretty inflamed a couple of times before we take the wisdom teeth out. Why don't we just take them out? We don't take them out straight away because they run very close to a nerve called the inferior dental nerve that supplies our lip and a little bit of our tongue. So when we take our wisdom teeth out, there's always a small risk that we can that this nerve can be damaged temporarily or permanently. So you need a good reason to take wisdom teeth out. So what my advice is to let them come through as much as they can. If they don't give any problems, leave them alone, just clean them. But if they start to get inflamed, let it happen once or at the most twice, then that's the time to have your wisdom teeth out. But don't have them out just because they're there. And then for somebody with haemophilia, they would need to have, a rise of perhaps 100% levels before they had their wisdom teeth out. And then the dentist would use all of those special measures we've talked about. And then after having a tooth out, people need to have a very, very soft diet. So not to traumatize the area for at least a week. And that is the difference between having bleeding or not. It's actually how what people do is they're so worried about getting an infection or a dry socket, they spend ages rinsing them out with salt or whatever, and that washes the clot away. So I think we have to just be very careful and gentle when we clean them around afterwards. But most important is a soft diet and to really be careful with that wound. If we were having a leg operation, we would actually, have a bandage or something over it. In the mouth, it's more or less impossible. So I think don't be worried about having wisdom teeth. Don't put them off because they have haemophilia, but don't have your wisdom teeth out unless they're causing problems. There's no need to. Is that okay?
Yeah, thank you so much. I think everybody in the chat is reacting to these answers, and this is I think incredibly useful information, very practical information
Mm,
for everybody within the
mm.
community. So thank you so much for sharing. We have a
Pleasure.
couple more questions for you. So we've had this pandemic happening.
Yeah.
There are different telehealth options. What are some of the
Mm.
best practices when using telehealth to access dental or oral health treatment?
Yeah. Well, I think telehealth can be used very, very usefully to sort of triage, to predict a problem. So, for example, if somebody is having a dental problem, that we can actually use photographs, we can actually use a virtual consult to diagnose the problem. So we can give people pain relief information. I've even mentored people to put in a temporary dressing that you can get from a chemist to take if they've lost a filling. So it can be used to predict and plan treatment so that we can do things like we can say, oh, well, that's likely to need a filling, so you don't need to worry, go ahead to your local dentist. Or we can see something that's looking really nasty and say, this is something that's going to need association with your hematologist. So we can actually plan and treatment plan. We can work with people with teledentistry who are very nervous. So we can do cognitive behavioral therapy. We can talk about treatment planning. We can talk people through things and give them advice, and we can monitor how they're doing. We can give them education via teledentistry. But sadly, in most cases, people need to see a dentist, have the operative stuff done, but it can cut down the number of visits. It can be very useful for monitoring people the day after a procedure, or if people have lesions in their mouth they're worried about, and so it's with smartphones nowadays, people can take really good intraoral photographs. So with nothing more than an ordinary camera and some good light, you can send a photograph to your dentist of a tooth problem or a gum problem, and we can have a pretty good idea and give advice and make plans before you come, especially if you need to have factor or liaise with your hematologist. So lots of options.
Great, great. Thank you. Thank you for that. Another question we had come in just right now. Does tranexamic acid, and I'm not
That's
quite
it.
sure I'm
Yeah.
pronouncing that
Yeah.
right, so I
Yeah.
apologize for that, everybody out there,
Yeah.
work similar to drugs like Amicar?
Yes, it does, except it's about twice to three times as potent. So it's actually at least twice as effective as Amicar. But that is also very good. They're both anti-fibrinolytics. That means they stop clots being broken down. So it means that the clots that are formed are stronger. They're less likely to be broken down by saliva, for example. Does that make sense? Yeah.
I think so. We didn't have a follow-up question, so I
Okay.
think that definitely made sense for that person
Yeah.
who's watching. Um,
Antifibrinolytics,
mhm,
antifibrinolytics are essential and they are the deal breaker. So it's not about just what happens before you're having a tooth out or during, it's what happens afterwards. And as I was saying, with the soft diet and perhaps not smoking, the having the antifibrinolytics course afterwards orally is the deal breaker. All of the evidence shows us that a 5-day course of antifibrinolytics after an extraction, especially wisdom teeth, is the things that mean it won't bleed.
Great, great. Thank you for that. We had one other question. This is kind of going back to the question about parents or caregivers that
Yeah.
are helping children. Are there any best practices for parents and caregivers when helping children with bleeding disorders learn dental or oral health self-management skills?
Yeah. I think the first thing is to get into a routine. There is absolute evidence that the habits that are introduced in early childhood persist through into adulthood, even if there's a temporary stop during adolescence. So I think the first thing is that parents should brush their children's teeth until they're at least 7 or 8 years of age. Even if they let the children brush their own teeth as well, they should make sure that a good job has been done and use the disclosing tablets to make sure that the toothbrushing is done. I think the main thing that we can do is to really think hard about children's diet. And I know it's very, very difficult to keep at the best of times to keep sugar away from children, but we do have a problem. So I mean, the best thing we can do is to try and avoid children having cavities in their teeth. So if the children have got a high sugar diet, make sure that they're seen regularly, make sure their teeth are sealed the minute they come through. And the first adult teeth come through between the ages of 5 and 6. So that's the time to have the adult teeth sealed. You don't need to have the baby teeth sealed. They are much more of a shape that doesn't attract the holes, whereas these teeth that come through age 6 need to last. They're adult teeth that need to last you for life, so they need to be sealed. There's another set that need to be sealed around the age of 8. So regular sealants. What else? Fluoride toothpaste. There is a big fashion for vegan toothpastes and a whole load of stuff that you might as well be brushing your teeth with water. Fluoride is so effective against cavities. So try and avoid fads or natural toothpastes, because however much you want to use that for food or whatever, this is the one proven thing that will prevent cavities in your child's teeth. So along with a healthy diet and watching out for hidden sugars, they're everywhere. So just look at labels and see what sugar is going in. Apart from that, don't talk about dentists being scary. There's so much in the media. So even kind of, oh, you're going to the dentist tomorrow, you know, it starts to put fear in. So I think positive messages about the dentist as well. Don't go down that kind of role, because it's so easy to do it. And start early. I think that's it, really. And if you're scared of the dentist and you hate going, get somebody to take your child who isn't. So you know, because it's so easy to pass on that fear. So people can only do their best, but supervise the brushing. Yeah.
Awesome. Thank you so much. Um, so I'm going to say thank you again, Dr. Allison Dougal, for being here with us. We cannot understand enough how much incredible information you just shared with us in a very short period of time. So we appreciate everything that you've been willing to share and your expertise today. So thank you very much. We also want to make sure we thank all of you who attended today. Thank you for coming out and attending the session. And I did want to give a couple of reminders. So your feedback does matter to us to help plan an even better BDC in 2022. If you could complete this evaluation, and you would be entered into a raffle for $75 gift card. Raffle winners are selected Thursday, Friday, and Saturday, and we will be emailing the winners directly. And with that, again, I want to thank everybody for attending. I want to thank everybody who, you know, kind of came. It's 6 o'clock, almost 7 here on the East Coast. So we appreciate you coming and learning about oral health and dental health and self-management skills. And we hope you have a wonderful night and enjoy the rest of the conference. Thank you.